Can you see my screen?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Right. Are you able to see the entire role play card?
Yes. Yes, ma'am.
Great. So this is for nursing. Okay. And while we are waiting, because there are students still joining us for the lunch break, I would like you to read the role play card and make notes. Make notes on number 1. How will you start the interaction? Would you need to introduce yourself? Do you need to ask the patient's name in the role play? How will you start? And then, of course, look at the tasks that you have to do. If you see the role play card, it's going to be quite lengthy to perform, right? Even in the tasks, there are subtasks. So if you see the second task here, second bullet point, first subtask here is give information, explain the medical term, then you have to reassure, then you have to explain again, you have to emphasize and stress the importance of ongoing care, the steps required. So like this, I would like you to read it, make your notes. I'll give you 5 minutes for this, and by then everyone would have joined. Then we can discuss it as a group, and then we'll have a go at it. Any questions?
No, ma'am.
Okay.
No, ma'am. No, ma'am.
I know some of you have just joined, and what we're doing is this is a nursing role play card. If I'm giving you time to read it, make your notes on how you will start the okay? And how will you structure it? How will you organize? There's a reason I have chosen this one because I think most of you have trouble in time management in completing a cue card, which can be lengthy to execute. So this is why I've picked up this particular cue card. If you see, even in the bullet points, there are sub tasks that need to be completed. Small tasks constitute a single bullet point. Like if you see the second one itself, there are 3 different things that you need to do. So I would like you to think about how you're going to manage this conversation from start to end in 5 minutes. Shall we start discussing? Yes?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Yes,
If you, now I'm going to pose some questions. I would not like you to answer as a group. I would prefer if you can raise your hand. I think you all are aware of how to use the raise hand feature on Zoom. By now, most of you would be aware of it, right? So if you want, if you're confident of your answer and you want to be given a chance to answer, please use this feature, raise your hand, and then I will nominate, then you can answer. It's just avoid chaos and disruption. Because when you speak collectively, it's hard for me to understand, and then that wastes everyone's time. So my first question is, do you need to introduce yourself in this conversation? Yes, Neetika?
Yes, ma'am, we need to introduce.
And why would you need to
It's
introduce?
optional.
Let Neetika answer.
Because patient has came after surgery, it may be like a follow-up. She has came for the removal of her stitches.
Okay, if you see the first, this particular aspect of whether you need to introduce yourself, this will always depend on your context information in the first task. The first task tells you where the conversation is starting from. Here, confirm the reason for visit means the conversation is starting from the beginning, right? And in your context information, this section, is there any clue that the patient has met you before?
Sorry, ma'am. One second. I'm interrupting you. Some background noise is confusing me, ma'am.
I'll switch off the
Too
fan.
much background noise, ma'am.
Okay, tell me if that is better.
No, still no, ma'am.
Still,
No, ma'am. It's from online students. Someone is playing
Yeah.
songs in the back.
okay. I think this is why I muted initially, but then
Now it is okay, ma'am.
Now it is.
Ma'am, okay.
No, yes, ma'am.
okay. So my question was that, do you need to introduce yourself in this role play? Neetika answered correctly that no, yes, you need to introduce yourself. But I asked why. Why do you need to introduce yourself? So there are 2 things that you must consider when you're deciding this. First is this context information, and the second is your first task. Your context information usually tells you whether or not the patient has met you before. If the patient has met you before, obviously in that case, they will know your name. In this role play card, is there any clue, any information that the patient has met you before?
No, ma'am.
You are patient.
Sorry?
Says your patient.
Could you repeat the question, Shalini?
Ma'am, she is saying in the starting it's written your patient.
Your patient is written, this is term is used because you are speaking to the patient in this role play. This can't be the basis for determining that you know the patient from before. That has to be clearly mentioned, that this is a follow-up appointment or you met this patient 2 days ago, those sort of clues. So your patient here simply means you are having this conversation with the patient today.
Ma'am, lesion has been removed, so the
But
patient has.
right, but it is not confirmed whether you removed this. Are nurses involved in surgery? I think it's a certain
Yes,
job.
ma'am.
Yes.
Yeah, scrub
Yes,
nurses.
ma'am.
Yes.
As a scrub nurse, we involve.
As yeah.
Meeting
Is it
with the patient
mentioned
first
here?
time.
My follow-up question is it mentioned here that you
No.
are involved in the
No.
surgery? No.
ma'am.
No, ma'am.
Or
No, ma'am.
the information
No,
you
ma'am.
have is the medical records. You have the medical records with you. See, you have to look for exact clues. If it were mentioned here that you met the patient 3 days ago or some days ago when the patient came to the clinic for removal of the lesion, that would have been a clue that yes, you've met the patient before. In this context, is there any clue that you have met the patient before?
No, ma'am.
No, ma'am.
So
No,
that
ma'am.
means you will need to introduce yourself. Your introduction will be required. Your name and your job profile. In OET speaking, what does an introduction constitute? Your name and what you do. What is your profile, job role? And then the second thing we usually see is the first task. The first task tells us what stage the conversation is starting at. Okay, so here confirm the reason for the visit. It's starting from the very beginning, right? So this will give you clues of how to start the role play. Now, my next question is, do you need to ask the patient's name or their details in this role play?
Yes, ma'am.
Confirm. We can confirm.
Confirm.
Do confirmation, ma'am.
Record
Raise your
confirmation.
hand. I told you if you answer collectively, it's hard for me to make sense of the answers. Okay, Dr. Sakirat, please respond. Do we need to ask the patient's name in this role play?
Ma'am, just before that, ma'am, I really had a doubt in the previous point.
Yeah.
Ma'am, the doubt was that if instead of nurse, it was a doctor here, a doctor's role card here. So do we need to introduce ourselves in that also?
Yes, unless it is mentioned that you have met the patient before, then you must introduce yourself. For instance, if it were framed in this way, that this is a follow-up appointment for your patient who had a lesion removed from his or her hand following this diagnosis. In that case also, we can give you the benefit of doubt that you might have met the patient. But in this case, it's pretty clear that you are meeting the patient for the first time. So even if it were a doctor here, your patient is this, had a lesion removed, we can assume that you are one of the doctors at the clinic. So you will need to introduce yourself.
All right, ma'am. And the answer to your question, I think that we need to ask the patient a little about his name and everything, because as you said, that patient has come to us for the first time, so we need to find some details, like his or her name, so at least we know how to address him or her, and what to call the patient in the conversation.
Okay. I have a rebuttal to this. Rather than asking it in a way where it seems that we are completely unaware why they are here, I think we must demonstrate awareness that we have information about the patient, about the diagnosis, about what medical procedure has been done so far, and why they are here today. So we need to demonstrate that awareness. That is the format of the exam. We have been given a prompt, so we must acknowledge this prompt when we start the role play, right? So can you think of what you will say to demonstrate awareness of this?
Yes, if we can say, if you do not mind, may I confirm the reason of your visit to the clinic?
This is clinic. Already we know, no, ma'am. So
Right. Bindu, I'll ask you to answer. Okay, Dr. Sikira, that's a good response. Not entirely correct though, but good attempt. I'll just ask one or two more people and then I can give you one sample answer. Sanjana, you raised your hand. Would you like to try?
No, ma'am.
Okay, Bindu, you wanted to answer?
no, ma'am.
Okay, Dr. Imtiaz.
Ma'am, we need to establish, ma'am, because the patient has come to remove the stitches, which means he might have a referral letter. So from that, we can confirm the patient that you came for the stitch removal of stitches, and is it your name? So on. We
I'm just asking about the name right now. Let's not even go to the agenda, I'm just asking about the patient's name. How will we ask the patient's name, or can we assume the patient's name? What are your thoughts about this?
Ma'am, we should confirm the name, ma'am.
Confirm the name. And how can we do that? Any? Hmm.
Am I speaking to Mr. David?
Okay. So David is the name you have assumed,
Yes,
and
ma'am.
you will just frame it with this way, that as per the medical information, am I speaking to Mr. David? I have the medical records with me here, and then the conversation can proceed.
Okay,
Okay.
ma'am. Okay.
Susanna,
Yes, ma'am. Because first we are meeting to the first time to the patient, so we need to greet the patient. Good morning, ma'am. How can I help you? Like that. Is this the correct one or? Hello.
so we are discussing about the name now. That can you assume the patient's name, or would you need to ask it during the role play? I'll give you two examples. First example is, hello, my name is Gurleen and I'm one of the nurses in this clinic. May I ask your name, please? The second one is, hello, my name is Gurleen. I'm one of the nurses in this clinic. Am I correct in thinking that I'm speaking to Mr. David? Which one is more appropriate?
Second one.
Second one, ma'am.
You're correct. Second one is more appropriate because it will demonstrate an awareness of the role play card to your assessors. It's already mentioned here. This information is already known to you. And if you see the first task also, confirm the reason for the visit. Confirm means what? You are going to outline the agenda to the patient. That today this appointment was made for this and this reason. Bindu, Faiza, and Seema, do you have any questions?
Actually, I wanted to try before that you said.
Yeah, even I.
Okay, Faiza, you have a question?
No, ma'am. Actually, I joined a little late. I just wanted to know that it's a follow-up task, ma'am. And in this case, we have to establish the agenda. Yes, we will confirm the patient's name, and then we establish, and then the patient will, come into the answers, and then the communication will go on.
Right.
Is that right, ma'am?
Right. Parul, do you have a question?
Yes, ma'am. I want to confirm that we maybe start like this. As I can see from your case notes, you are come here to remove your stitches. Am I right?
Yeah, you can start like this, but you shouldn't be asking the patient that, because confirm, one is find out why the patient is here, or find out if the patient is aware of why the appointment was made. If this was this task, then you should be asking, is it, like you said, here it is clearly mentioned, confirm the reason for the visit. And then in brackets, you are given the reason, it's given there, which means you have to tell this to the patient. You have to convey why this appointment has been made.
Okay, ma'am. Okay, I understand.
Yeah. So how will you say this?
Yes. May I, ma'am?
Yeah, go on.
Okay, so as I can see from your case notes, David, you are here to remove your stitches and wound cleaning. After that, we will do redressing the wound. All right, like this.
Right.
Okay.
Shalini, any questions?
Yes, ma'am. Good afternoon, ma'am.
Yeah.
Ma'am, actually, the first bullet point is not clear to me. The confirmed reason for visit. I have to explain to patient, or patient asks to us, or we need to confirm why
You have to convey. You have to convey this information to the patient.
Okay.
If your bullet point was written like, find out if the patient is aware of why this appointment has been made. And then in brackets, this information was given. Then you should have asked, are you aware of why you have been invited, a call to the clinic today? Or are you aware of why we have made this appointment today? Let me clarify. And then you go on to explain. But here in this case, it's very clearly written that you need to confirm the reason for the visit, that why the patient has been called to the clinic.
Okay. Thank you. Thanks.
So till here, we have discussed the cue card till here. Okay. I'll give you a very small demonstration of how we should start and then lead up to the end of the first bullet point. Then I can take some questions and then we can go on to the remaining tasks. So we discussed that your introduction is required. We can assume the patient's name and then we can confirm it by demonstrating awareness that we have the medical records with us and we are just confirming the patient name. We can then establish the agenda utilizing the information given here and here. Right, so you can say, hello, I'm Gurleen. I'm one of the nurses working in this clinic. Is it all right if I address you from your first name? And then when the patient says yes, thank you, David. Now there is a reason I did this. Patient is 51 years old, right? That means they fall into the, I don't want to sound an ageist, but elderly age group, right? As a sign of demonstrating respect, I would want to confirm if they are okay with me addressing them by their first name. There are two ways you can address someone, right? Either you can straight away ask for their, like you can say Mr. and then their surname, or you can call them by their first name. Like you can either call me Gurleen or you can call me Miss Khaira. Depending on the level of formality, we use this. If it's a young patient, you can go on to use the first name, right? But for the elderly age group specifically, I feel it's more respectful if you can seek their consent to demonstrate respect for the patient. If you seek their consent that they're okay with you addressing them by their first name. So this is just one of the ways you can do this. So that is why I said that David, Mr. You can assume a last name also, Mr. Baker. Is it all right if I address you by the first name? And then once they say yes, you can say, thank you, David. So David, I see from your medical records here that you recently had a lesion removed from your hand. How have you been feeling since then? Then the patient can say, I've been feeling fine. So on, then you can come to the first task. Okay, David, I'm glad to hear that you've been feeling okay. So today we've made this appointment to remove the stitches and also to clean and redress the wound and to ensure that it's healing well. Before we proceed to do that, I want to know if you have any questions or concerns. So from start till the first point, this is one of the ways you can perform this role play. Now, I would like you to ask me any questions, or if you want to try, you're most welcome to do that. Khaira?
I'll give it a try, ma'am.
Yeah.
Hello, good morning.
Good morning.
My name is Faiza, and I am one of the nurses working here in the clinic. How are you doing?
I'm doing well.
Okay, so would you mind if I call you by your first name?
You can do that.
Okay, Mr. David. So we are here to remove your stitches and to see the if the wound is dry and clean. Is there anything else that I can help you with?
Not anything else. Is
Okay.
there anything about this that you want to talk about? Like before I do that, is there anything that you want to ask? You see the difference? When you say, is there anything else, means patient can talk about any other medical problem, but that's not what you want, right? You have to find out if they have any concerns about what you are going to do today. You're going to remove the stitches, then you're going to redress the wound and ensure it's healing well, check on its progress. And before you do that, you have to find out if the patient has any concerns. So frame it that way. Okay. Second thing is, Khaira, we don't use salutation, Mr. or Miss. We don't use it with the first name. We use salutation either with the full name, first name and last name, or only with the surname. So when you asked me that, can I address you by your first name? And then I said yes, and then you said Mr. David, that is incorrect.
Okay.
Okay. So this was a good attempt. I'm happy. Would anyone else like to try, or shall we move on to the second bullet point? Yes, Namrata?
Ma'am, I want to try. Can I?
Yeah, go.
Good afternoon. My name is Namrata, one of the registered nurses in this clinic. So, could you please tell me your name, please?
Yes, my name is Susan.
Um,
Could you please, sorry, I'm interrupting you, Namrata. Rather than saying, could you tell me your name? Could you please confirm your first and last name for me? Confirm would be better.
Could you please confirm me your name, please?
Yes, my name is Susan Baker.
Oh, okay, Miss Baker. Can I call you from your first name?
Yes, you can.
Okay. So, Miss Susan, so you know that you are here for the removal of stitches, and we are also seeing the progress of your wound also. And during that time, we can also done the wound cleaning as well as redressing also. Is that okay to you?
That's fine.
All right. So, do you have any concern regarding all these procedures?
Yeah, then I will share my concerns. Okay. It was a good attempt, just needs to be more coherent, right? First of all, when you said that you are here for this and this, right? You can use signposting like today this appointment has been made, so we can remove your stitches. I'll also be redressing your wound and make sure it's healing well. Before I do that, I would first like to check if you have any concerns or questions. Right? Using signposting will help signal the sequence of how it's going to go. The only thing I added, the only difference between your and mine version is before I do that. Right?
Yes, sir.
Okay, let's move on to the second bullet point now. When you ask me if I have any concerns, I have a concern about the diagnosis, right? I can just share this cue card with you also. First bullet point for the interlocutor cue card is that when asked, say the doctor told you you had something called a squamous cell carcinoma, which you think is another name for skin cancer, so you're worried. So after that, we have to respond. This is the second cue card. I'd like you to think about it for a minute, and then I'll take some responses. Also think about the kind of language you should be using. The patient is worried. So it is not mentioned here, but what soft skill would you want to use here? What kind of language will we use if someone is worried?
It could be sympathetic.
Empathetic.
Empathy, ma'am.
Empathetic and reassuring language.
Yes, ma'am.
Shall we start?
Yes, ma'am.
Okay. For the first sentence here, give information about squamous cell carcinoma, and then bracketed information. It is a type of skin cancer caused by sun exposure, ultraviolet radiation, etc. So how will you transform this into your sentence in the role play? So I will also give you a patient response. So when you ask me if you have any concerns, the patient says, yes, I want to know what has happened because the doctor that day just told me that I have something called squamous cell carcinoma, but I couldn't understand. Maybe it's a type of skin cancer. I'm kind of worried about it. So how will you respond to this? Yes, Parul?
Okay. Can you repeat it for me about your concern?
Yeah, so when you ask me, like we discussed up until the first bullet point, right? You asked the patient if they have any concerns. So my response to that is that, yes, I am not really sure what has happened. The doctor that day simply told me that I have something called a squamous cell carcinoma, which I think is cancer. I'm really worried about it.
Oh, your concern are totally reasonable, Miss Jenny. So I will help you in the best possible way to give the information about this squamous cell carcinoma. May I proceed further to discuss it?
Yes.
Okay, so this squamous cell carcinoma is a type of skin cancer, and it is caused by sun exposure, or we can say that this ultraviolet radiations. All right, are you getting my point?
Yes.
Okay, thank you. Okay.
And then this one?
Yes, yes, ma'am. Okay, so now, okay, so for which we need to go for the surgery, and this surgery will help. Will in this surgery we will remove the lesion, and also this will help to reduce the chances from spread the cancer to another organs. So how does that sound, Miss Jenny?
One second. Small mistake you made here. Surgery has already happened. The patient has come after the surgery. The
Yes, ma'am.
removal of lesion has been done.
Yes, ma'am. Reassure.
Yeah, so there will be surgery. No, that's incorrect. Surgery has happened. So you need to change your language accordingly. Okay,
Yes,
Dr.
ma'am.
Sakira, I'll come back to you, Parul. Dr. Sakira, would you try?
Yes, ma'am. So I'll start from the beginning, give information from given. Yeah, it's natural that you are worried about it, because if anyone knows that they have cancer, they would get worried. You're right in assuming that it is a type of skin cancer. If it would be all right with you, I can give you some information on it.
Yes.
Yeah, this squamous cell carcinoma, as your doctor explained, is caused by sun exposure. It is usually due to ultraviolet radiation in the sun rays. So I think, are you understanding me?
I am.
All right. I'll tell you, like, you have had your surgery. So the doctor who performed your surgery is quite experienced, and there is usually never any complication or further distress to the patient who has had his surgery. If you have any doubts about that, please do ask me.
Okay.
So what we have to remember is that you have to monitor your skin. You have to check if there are any new changing spots, and you do have to have some regular checkups, so that if any new problem arises, we can come to know about it. Please do come to our clinic regularly for that. Are you following me?
Yes.
All right. So, ma'am, we came to the next point. Should I continue?
Okay, so no, we'll just discuss the second bullet point for now. I think you did really well. My only problem is in the broader aspect of time management, this particular bullet point would consume a lot of time if you go with the same response that you did now. So we also need to think about time management, right? We will have to just rush up the pace a little bit. And there are 3 different tasks in this bullet point. So we'll need to think about the transition from giving information to reassurance to then stressing the importance of the ongoing care that you will be providing, right? So those transitions, I feel, could have made the switch from 1 to 2 to 3 much more clearer, but you did well. Would anyone, yeah?
Sorry to interrupt you, but I do get the same response in my speaking session also, that I don't make transitions smoothly. So to practice that, how should I practice that? Like,
I'll give you an example. I'll take one more response and then I will probably give you a demonstration of how we can go about the second bullet point.
Sure.
Amrinder?
Yes, ma'am. Like, ma'am, after giving information about squamous cell carcinoma, can we ask a patient again? Do you have any other? If you have any question, you can tell me. Like, then patient concerned about the surgery, then we will reassure the patient about the lesion wound and cancer likely to spread.
Okay. I would like to hear the exact response if it's okay. Someone named iPhone, please identify yourself and then respond.
Yes, ma'am. My name is Renuka.
Yeah.
Yes, ma'am. I want to try it here.
Go ahead.
Yes. Well, ma'am, please can you repeat it again, please? I'm sorry, really.
Yeah, so I'm worried. The doctor just told me I have squamous cell carcinoma, but I couldn't really understand what it is. Is it a type of cancer?
Okay, Miss Chani. Yes, I can understand, and you're also looking worried about it. Okay, I will explain you about the squamous cell carcinoma. You are diagnosed with it, but before explaining the procedure, are you ready to heard about it? Then there is anything else about the procedure that you had already. So you want to ask me?
Not yet. Please explain what this means.
Okay. Okay. There's a squamous cell carcinoma is like one type of the cancer that is caused by the ultraviolet radiations that is released by the suns. And nowadays, like most of the people get it. Some people are getting genetic, or some people are getting by the ultraviolet radiations. So after it, you already had a surgery. Now you will be feel better as soon as possible. There is anything else about the procedure you want to know about it?
Okay, I'm going to stop you here.
Okay, ma'am.
Two problems that I can see. Although language is good, you are confident, linguistically, I think this is a good response, but you will take too much time. We also need to think about the time management. We are just on the second bullet point here. So you will need, like I told Dr. Sakira, you will need to do this much more quickly. First of all, you don't need to take consent if you want to explain something about a medical condition. Consent is to be taken when you're probing into the patient's life. We take consent, one, when we are asking something intrusive or when we feel that the patient, we will require their permission. If you are explaining about a medical term, you don't need to take the patient's consent for that. Okay. And then secondly, surgery has already happened. So it would be incorrect to ask if they have any concerns about the procedure. Surgery has happened, right? You already inquired about the concerns in the previous task also. So here you are simply explaining what the condition is. Then you are reassuring them about the possibility of it reoccurring again. So if you see, reassure the patient about the effectiveness of the surgery. So you will have to reassure them that yes, this is the positive thing is that cancer, it's a scary thing, right? The patient says they are worried. So you first explain that this indeed is a type of cancer. However, the positive thing is that this has already been removed and the efficacy of the surgery is quite high, which means the chances of it happening again are typically reduced or significantly reduced. Then we can move on to the third task here, stress importance. So here the transition would be that I would also like to talk about two things as a part of the ongoing care that we will offer for you. That will be a part of the prevention. May I explain? Then you can take the consent and explain 1 and 2. One would be monitoring the skin for any changes. The second would be regular follow-ups with the doctor so that the doctor can detect. Guys, please keep yourself on mute. And the second would be regular follow-ups with the doctor where they can detect any changes that may not be visible to the untrained eye. Right? So this is how we'll go about this task. Ishant, do you want to say something?
Yes, ma'am. I wanted to perform any bullet point.
Yeah, the second one.
Second bullet. Okay, ma'am.
Entirely.
Okay.
Go ahead.
Okay. All right, ma'am. Just give me a second. So thanks for the confirmation, Mrs. Gina. And before moving further, I wanted to know, do you know anything about cell carcinoma, squamous cell carcinoma?
The doctor just told me there is some type of cancer, but I don't have much idea about it.
All right. I understand your concern. So I wanted to tell you about the squamous cell carcinoma. And it is a type of a cancer caused by sun exposure and ultraviolet radiation. Are you with me so far?
Yes.
Okay. So I also wanted to reassure about the you about the effectiveness of the surgery. So the effectiveness of the surgery is that you have had been underwent a surgery and the lesion was removed and the cancer was unlikely to spread in your other parts of the body. So I hope you understand my point, Mrs. Dina.
Yes.
All right. So I wanted to tell you some importance and monitoring about the uh, how are your what do you mean? Sorry, I'm just give me a second.
I'd also like to tell you about our
I also like to tell you about the
uh,
regular monitoring of regular monitoring and checking for the whether the new spots are presenting in your body, other parts of the body, and it is very crucial for you to see the doctors in the regular basis.
Okay, good, good. So I'll give you a small demonstration of how we can go about it. This bullet point starts after the patient has shared their worries or concerns, that they are worried or fearful about this term of cancer, right? So we'll start with an empathetic statement or a validating statement, which normalizes their concerns, that it is that I completely understand how worrying this diagnosis can be for you. You are right. Squamous cell carcinoma, which is a medical term, is indeed a type of skin cancer that is caused by prolonged exposure to sun or ultraviolet radiations. However, the good part is, or the positive side to this is, that the lesion has been removed, and you shouldn't be too worried about it now, because after the lesion has been removed, the chances of this cancer spreading to other parts of the body is quite low. There are hardly any chances of this happening. That said, I would also like to reassure you that as a part of the follow-up or the ongoing management that we will provide, you can, one, monitor the skin for any changes that can help in detecting it early if at all it happens. And secondly, you must have regular follow-up visits with the doctor so that any changes that are not visible to the normal eye can be detected in that visit. How does that sound? And I did it a little quickly because, we have other 3 points are left. So we can't take up a lot of time. All of you, although as wonderfully as you did, you took up a lot of time. So we'll have to rush through this bullet point. Is that okay?
Yes, ma'am.
And
Yes, ma'am.
and Dr. Khaira, there are 2 transitions I used. I used however, this linking word, to show a contrast. Yes, because the first statement was an acknowledgement that this is worrisome. I used however to indicate that a positive news is coming now. That don't worry, I know this is a type of cancer. However, you shouldn't be too alarmed about it. Then the second transition I used was that said, having said that. Right? Or you could also say, as a part of the care that we will provide, I would like to suggest 2 things. And then by using 1 and 2, you are signposting. You are basically structuring the 2 things that you are suggesting.
All right. Thank you.
Any questions about this?
No, ma'am.
All right, let's move to the third one. Take a minute to think about what you will say here. Also think about the language. Resist. Resist information means you will need to, what do you understand by resist?
And we are supposed to deal with the reluctance.
Yes. The patient is going to ask for something, and that is already mentioned. The patient is going to request information about further surgery. So you will have to resist this. And how you can resist, the rationale is already given. That one, the patient will need to speak to the doctor about this. It is beyond your scope of work. And then there is another task also here. Find out about the patient's habits when in sun. So you will need to do a transition from resistance to finding out. I'll give you a minute and then we'll discuss. Shall we discuss?
Yes, ma'am.
Right. Priyanka, would you like to try? Okay, Dr. Sakirat, would you like to try?
Yes, ma'am. So I have given you all this information. Do you have any doubts?
Yes, I would like to know what about the need for a further surgery? Would I need further surgery?
I understand that you want to talk about surgery, but you will have to have this conversation with your doctor to find about it further. Do you have any other doubts?
No, actually. So see, if you see, there is.
I know. Was just I was covering the first point fully, so that
No, I think I was more intrigued about the need for further surgery. I wanted to know that particularly.
All right, all right. So there are a few things I would like to ask you about.
Okay.
Is it all right with you?
Yes, sure.
Yeah. When you go out in the sun, do you wear hats?
Yes, I've started using a sunscreen of SPF 30 and higher, and I also wear a hat when I'm out in the sun.
Okay, all right. Thank you.
All right, great. Would anyone else try?
Hey, ma'am. Shall I, ma'am?
Yes, Faiza.
Okay. Do you have any other concerns that I can answer you with?
Yes, I would like to know if there is a need for further surgery.
Your question is pretty valid, but I think that in my opinion, the doctor is Sorry, ma'am, my daughter is crying. I'll get you later.
That's all right. Take your time. Or you can calm her down and I can come back later. Is that okay?
Shall I?
Ma'am, may I?
Yes, Neetika?
May I?
Yes, ma'am, may I start?
Yes, yes.
Okay, Miss Jenny, I totally understand your question. I appreciate that. But I would like to tell you that I'm not an authorized person to tell you about the further surgery. So I can do one thing for you, that I can book an appointment with your doctor so that you can talk with him directly regarding your concern.
Okay.
Are you getting my point?
Yes.
Yes, ma'am. I need to go further also.
Yeah. The second one, right now.
Okay, so moving on further, Miss Jenny, I would like to know about your habits under the sunlight. Do you prefer to use sunscreen or hats to protect from sunlight?
Lovely, Nitika. I think that's a good response. So the transition that Nitika used was moving on further. I think that is good, right? You could also say moving on to prevention, or I'd like to talk about prevention. So I'll just give you a small demonstration of how this can be done. So resisting request, which means you are not meeting the expectation. The patient asks you a question, but this is not within your scope to answer. So obviously you can acknowledge that that I'm afraid. When you use a phrase like I'm afraid, you acknowledge, you legitimize the discomfort that I know patient is expecting to hear something, but you cannot answer that at the moment. So you could say something like that. I'm afraid I cannot answer this for you. It's best that you discuss this with the doctor who's aware of the specifics of this answer, right? Or you could, I think when Faiza was answering, she also legitimized the patient's question by saying that's a good question or that's a valid question. I think that's a great way to establish rapport with your patient. One of the criteria is relationship building, right? So when a patient asks you a question, you can acknowledge that it's great that you're asking these questions, or it's good to be proactive and ask questions and express your concerns. However, or I'm afraid this is not within my scope of work to answer this. So you can speak to the doctor about it. I can talk to you about prevention. Moving on to that, is it okay if I ask you a few questions about your habits in the sun? So that is how you can do task number 3. Right? Let's move on to task 4. Stress need for ongoing prevention. The continuing to cover up when in sun, prevention of further damage. Find out about the patient's wound post-surgery, any pain or discharge. Again, there are 2 things that you need to do here. One, you will need to stress the need for ongoing prevention. And second is about the inquiring about the wound post-surgery, any pain or discharge.
Ma'am, before you move further, can I ask something?
Yes.
Ma'am, for all the tasks, we have to use a signposting. Like if I'm moving from 2nd to 3rd, here I have used. And again, if I'm moving from 3rd to 4th, again, I have to use a signposting.
If you don't, see, I would say these are transitions that guide your listener as to in which direction the conversation is going. And if I am the listener, I would want to know that which section is coming up now. What are we going to talk about further? It should sound natural. So whatever we've discussed till now, we are just, it doesn't sound forced. If we are reassuring, then we are moving on to discussion. So yeah, it makes sense to use a transition. After reassurance, you can say that I'd like to suggest 2 things that will be a part of the care plan. Here also, first you are telling the patient that this is not something that you can answer right now, but you can talk about prevention. And that for that, you need to ask some questions. Right? And if you see this task also stress the need for ongoing prevention, this is a part of prevention only. So when you give that signposting or that categorization to the patient, that now this section is going to talk about prevention, first you will ask questions, then make suggestions on what to do further.
Okay, ma'am. Thank you.
All right, you have your hands up, Ishant.
Ma'am, can I perform the previous?
You can perform both, resist and then this one, third and fourth together.
All right, ma'am. So, okay, Mrs. Gina, your concern is believable. But I wanted to tell you that giving information about
I'm going to interrupt you there itself, Ishant. Believable, I would want you to use better language. It's believable means it just sounds a little hard, judgmental to me. Right?
All right, ma'am.
Yeah, so I would say use something like, that's a good question, or it's good to see that you're asking questions and taking a proactive role in your health management, something like that. Oh, that's a good question. That's a valid question. That's a reasonable concern.
All right. All right, ma'am. Okay, Mrs. Gina, your concern is reasonable, but I wanted to tell you that giving information about further surgery is not a part of my job, as I'm not authorized for the same. But I will arrange a meeting with the doctor who will assist you for your concern. Are you comfortable with that?
Yes.
Okay. Apart from it, I wanted to know how you are managing with the sun exposure. Are you covering yourself with the hats or applying sunscreen?
Yes, I'm using an SPF of 30 or higher, and I also use hats when I'm out in the sun. But to be honest, I think in my teenage years, I've spent so much time in the sun that too much damage has been done.
All right. I understand your concern, Mrs. Gina, but it's a very crucial for you to follow your ongoing prevention. For example, to cover up yourself from the sun exposure and wearing hats, and you can wear hats or something and apply sunscreen from prevention from the further damage.
Okay, I'll continue to do that.
Okay, that's good. So, Mrs. Gina, I wanted to know that if you're having any post-surgery complications, like any pain is there or discharge from your wound.
Okay, good. And Ishant, be careful about switching from Miss to Mrs. Unless I specify that I want to be addressed as Mrs., don't assume that.
All right, ma'am. Sorry for that.
It's fine because you use that's why, you know. Adonai, if I pronounced your name correctly. I'm sorry if I mispronounced it.
Yes, ma'am.
Did you want to say something?
No, ma'am.
Oh, you
I'm
have
fine.
your hand up, right. So, Feza, again, yes?
Yes, ma'am. Shall I try now?
Yes.
Sorry about that.
No problems.
Okay, Miss Mary, your concern is pretty valid, and I really appreciate it. But I'm afraid it's out of my nursing scope to answer such questions. I would rather make an appointment with the doctor to clear your concern. Would that be okay with you?
Absolutely.
Okay. Moving further, if you don't mind, I would like to ask you if you have you been taking any precautions regarding sun protection?
Yes, I wear an SPF and I also wear a hat, but I've spent too much time in my teenage years in the sun, so too much damage has been done already, I guess.
Okay, that's great that you are already doing it. Here, I would like to tell you that it's very important that you have to continue covering up your skin while going out in the sun. Apart from that, it was really important because it will help you to prevent further skin damage. Would that be okay with you?
Yes.
So, is there any? Do you have any other concerns regarding your surgery?
No, nothing about the surgery.
Okay, ma'am. That's it.
Right. So you
can I try?
Yeah, just a second. Feza, you had to find out concerns not about the surgery. You had to check up on the progress of the wound. Right? So you could have said that I'd like to now check up on your wound. Have you experienced any pain or any discharge? This is what the task is.
Okay, ma'am, I didn't read it actually. Sorry.
No problems. And who wanted to try?
Renuka.
Right. Go ahead, Renuka.
Okay, Miss Kathleen, your concern is valuable. I appreciate it, but I'm really sorry about it. This is not part of my job. But for your further concern, can I arrange an appointment with the doctor for you so you can ask your question?
Yes.
Okay, Jani, I want to ask you something. Can I ask you?
Yes.
Okay, Miss Kathleen, when you went outside, that time you applied the sunscreen on your body and you put the hat on your head to cover up your skin.
I do.
Oh, that's good. Okay, then I want to tell you one more thing. It's very important when you go outside with someone in a restaurant or in a mall, that time you should cover your skin. That will help you to prevent from getting the ultraviolet rays from the sun, and that help you to stay healthy. And I want to ask you one more thing. Do you feel any pain and discharge on your wound area or nearby the wound?
Okay. Good, Renuka. You just need to structure it a little better, right? I'll just demonstrate of how you could have done this differently. So in the last task, when we finished, we asked about patient's habits. And then the patient says, I've spent too much time in the sun, although I use sunscreen, although I wear a hat, I just fear too much damage has been done already. So we need to respond to that by emphasizing the importance for ongoing prevention by doing this, right? So when the patient says that I'm already using sunscreen and I'm already using hat, you could acknowledge that in a good way, that it's great that you are using a sunscreen and you're seeking shade when you're in the sun by a hat. And I understand that you are concerned about too much damage already being done to you being in the sun in your teenage years. But it's okay. It's never too late. I would suggest it is crucial. Do you know the skill called labeling? I think most of you must have come across.
Yes, ma'am.
Right? Labeling, highlighting the importance of something. So here, when you stress the need for something, you use labeling. So labeling, we used emphatic words like it is crucial, it is important, right? It is
Imperative.
essential or imperative. It's vital. So here we need to use that. It is essential, it is crucial that you continue to do this because this will greatly reduce the risk of developing further lesions. Now, I would like to, now you can ask them if they have any questions. Do you have any questions about what we have discussed so far? And when the patient says no, then you can say, now I would like to check up on your wound. Have you experienced any pain or discharge from the wound site? And then the patient can answer, right? So in 2 steps, we can complete this task. And then I'd like you to come on the last bullet point. We'll discuss this, and then I'll choose one volunteer to complete the entire role play. We discussed it in chunks, we spaced it out. Now we'll see how it can be consolidated. So very quickly, take a minute to see what we will say in the last bullet point. And let me tell you what the patient is going to say to this. So when you ask if there is any pain or discharge, no pain, no discharge, but the patient will ask if these stitches can be removed later on. That's it. All right, who would like to try? Dr. Sakira?
Yes, ma'am. So, thank you for telling me about your post-surgery wounds. But do you have any questions before we proceed? Yeah.
Yeah, I'd just like to ask if it's too early to remove the stitches right now. I feel the wound is healing well, so why don't we leave the stitches in?
Yes, it is a valid concern. The thing is that typically stitches are removed after 7 to 14 days of surgery, and timely removal of stitches helps in wound healing. And after that, which the doctor assesses you to see if there is any problem with the stitches. Are there any other questions?
So if we remove the stitches now, what precautions can I take to make sure that it isn't infected later on?
Yes, that is a very good question. So you need to keep the wound clean, and the area around it should remain dry, and you have to keep it covered. So do I have your consent to remove the stitches?
Yes, yes. I think you did great, Dr. Sakira. The only thing is, after you advise on keeping it clean and dry, first check with me if I'm okay with that suggestion. Then you can take my consent. You can obtain the consent to have the stitches removed, right? Okay. So you can say that you can keep. So to ensure that the wound keeps on healing, please make sure that you keep it clean and covered and dry. Would you be able to do that? And once I say yes, then you can say, all right, I want to make sure that you're comfortable with this. So I want to ask, can I remove the stitches now? And then the role play can end.
Okay.
All right, so we've discussed the entire role play. Who would now like to perform the entire role play with me? Is there an exam student? Anyone who's taking the exam on the 22nd?
Hello, ma'am.
Right. Is there any exam student? Someone who's taking
Yes, ma'am.
exam on who is it? What's identify yourself, please, your name?
Amrit, ma'am.
Sorry?
Amrit, ma'am.
Amrit, right. And Amrit, I don't think you've had a chance to respond when we were all discussing. So great. Now, Amrit and I are going to perform this role play card. Everyone else has heard, we've set the expectations already, the kind of language we're looking for, how the sequence is going to go about it. So what I would like is Faiza, you can be the watchkeeper. Please start the timer and stop us when we have reached a 5-minute mark. The others, I will request compare Amrit's performance, and I'm sorry for putting this pressure on you, Amrit, but
No problem.
we've already discussed what good responses are going to be like. So I'd like you to make notes on what Amrit does well and what are the things that she can improve in the role play. Is that okay?
Yes, ma'am.
All right.
Yes.
Faiza, are you ready with the timer?
My heart is beating faster, ma'am.
Yes, ma'am.
Okay. Okay. Start, Amrit.
Yes. Just wait, ma'am, please. Just 1 minute. Okay. Hi, good morning.
Good morning.
My name is Amrit. I'm one of the registered nurses in this clinic. Am I right in thinking I'm talking to Jennifer?
Yes.
Okay, that's good. Jennifer, am I right? You're here for removal of stitches and wound cleaning. Is that right?
Yes, I was asked to come in today.
Okay. So, Jennifer, before proceeding further, if you have any question regarding this, then you can ask me.
I want to know why this has happened. In the last visit, the doctor just told me I have something called as squamous cell carcinoma, which I think is a type of
Okay.
cancer. And then I was asked to undergo surgery. So I'm quite worried about why this has happened.
Yes, I acknowledge your concern. Where are you coming from, Jennifer? So your concern is regarding squamous cell carcinoma, right?
Right.
So I would like to inform you the squamous cell carcinoma is a type of skin cancer that is caused by a sun exposure or ultraviolet radiation.
Okay.
Am I clear to you?
Yes.
Or apart from that, I can reassure you the lesions are already removed. And good thing is that the cancer unlikely to spread one part to another part. Am I understandable to you?
Yes, that's reassuring to hear.
Okay, that's good. So also I want to inform you the importance of skin monitoring, and it's necessary for checking the changing spots, and another point is a regular checkup with doctor.
Okay.
Does that sound good?
That sounds all right. I'll do both of these things. But is there a need for further surgery also? I'd like more information about that.
Yes, your concern is reasonable, Jennifer. So I understand you are worried about your further surgery, but I'm sorry to. I'm afraid I'm not a right person to talk about this surgery. So what can I do? I can book appointment with the doctor that you can talk with doctor regarding your surgery. Would it be okay with you?
Absolutely. Thank you.
Okay, that's good. Okay. Moreover, if you don't mind, I would like to ask about your habits. Whenever you go in sun, and then you can apply anything like a sunscreen or hat.
Yes, I make sure I seek shade with a hat, and I also wear a sunscreen. But I've spent so much time in the sun that I think too much damage has been done already.
Okay, that's a good thing. You are applying the sunscreen and hats, and but I want to tell you that it is very crucial for you. You should need to continue with that because it prevents from a further damaging, and it is crucial for you. Would you able to do that?
I'll do that. I'll follow it.
Okay, that's good. So apart from that, I would like to ask you, do you have noticed any pain or discharge at one side?
None at all. It's completely fine. In fact, I was going to ask you, if it's important to remove the stitches today itself. Can't we leave it on for some time?
I'm sorry. I think I missed the last sentence. Could you please repeat for me?
I want to know if it's important to remove the stitches right now only.
Okay, your concern is reasonable. So I would like to inform you the reason for the removal of stitches now, because your wound is healing now. And another another good thing is the doctor already assessed it. So, and it's typical, usually it is removed within 7 to 14 days. I am understandable to you?
Yes.
Okay, now are you?
5 minutes are up. Well, good. Good, Amrit. Everyone, a round of applause. I did well. And the good part is you managed to reach the last task. So, even though you couldn't advise on aftercare, you just missed a very small section of it. So, great job on the time.
I don't know, ma'am. How I don't know how I perform this. Please tell me, ma'am.
Let's
correct me, please. Yes.
Before I come to my feedback, I want to, and everyone's praising you. I see so many comments. People are saying, well done, Amrit, Ramveer.
Thank you so much. Thank you. Thank you so much.
All right. Now, the peers, those who were assigned the responsibility for feedback, what would you like to say to Amrit? She did well. We all know that. Pointers for improvement. What do you think she could have done better? Ishant?
Yes, please tell me, because if you correct me, then I think I learn more.
Ma'am, some of minor grammar errors.
Sorry, could you repeat that?
Some of minor grammar errors.
Minor grammatical mistakes. Okay. Do you remember a specific mistake that might have caused a strain or that was
yes, please.
significant to change meaning? Do you recall any of it?
I seriously don't remember, ma'am, but I heard some, so I'm giving my.
Ma'am,
yes, Suman, please.
In this yes, shall I?
Yeah, go on.
Yes, in the starting, she used this make like no confirmation of the name directly.
Am I right in
this,
thinking? No,
yes.
I confirm. I think. Am I right in thinking I'm talking to Jennifer?
Yeah, that she confirmed. She assumed a name and then she confirmed that am I
yes.
to this person. Yeah.
Yes, otherwise is okay. And 2-3 times use this apart from that 2-3 times
Yes.
used. And also some fillers like sometimes. Yes. And also she used moreover, that trainers are not allowed to use this moreover, as this is a outdated connector, so that's why used.
Yeah,
But otherwise,
Okay.
Amrit, you done a great job.
Yes. Otherwise, this,
Thank you,
good.
Parul.
You valid
Thank you.
the concern and show good empathy and use back channeling also. This is a positive points also.
Ma'am, I have a question. Can I? I think moreover, mostly avoid in writing or also in speaking.
Moreover, it's an academic connector. That is why we don't use it in OET writing. OET writing is about business correspondence.
Yes, ma'am.
We avoid academic connectors like furthermore or moreover, right? We also avoid outdated connectors like henceforth and.
Okay, ma'am.
Right? So, but in speaking, even if you say it, as long as it doesn't disrupt the flow, it's fine. It's not a major mistake.
Okay. Okay. Thank you so much, ma'am. Thank you so much.
Ma'am, I would also like to add, like in the initiation, she actually didn't, establish her. She, rather than it will sound like it's eliciting, like she is eliciting.
So, rather than confirming Amrit, you had to convey this information to me that today the reason for this appointment is that these stitches need to be removed. And we also need to clean and redress the wound to ensure it's healing well, or so that it continues to heal well. And before I would like to know if you have any concerns or questions.
Okay, ma'am. Thank you so much. Yes, ma'am.
And one more thing, ma'am, that we have learned from Ma'am Saika, that we never say I would like or I can reassure you. We always state it like I reassure you. Not can or I would like to.
Okay. Yes, I think I have some grammatical errors.
Just a second. Could you repeat that, Renuka? I would and about the reassurance.
Ma'am, Saika says like always say I reassure you. It's not like I would like to reassure you or I can reassure you. It is always in a static verb. I reassure you or I assure you.
Not much of a difference, to be honest. Even if you say I'd like to do that, I don't think it's incorrect. Yeah.
Yes, ma'am. Actually, I read. I can reassure you. I read from your case notes also, like from your book.
Yeah, let me reassure you. Let me assuage your concerns. Please don't be alarmed. There are so many different ways. The idea is to reassure the patient.
Thank you so much.
And in the on the topic of grammatical mistakes, as long as it doesn't change the meaning or it causes a significant strain on the listener, like as long as it doesn't impede the listener's understanding, it's fine. We're speaking in a sometimes in a natural flow. You can make minor grammatical mistakes as long as it's not changing the meaning or causing any confusion to the listener. It's fine.
Then please tell me how it's going.
So Amrit, in your case, I feel the organization needs more work. I feel that one, you misunderstood task one, right? So
yes, ma'am.
You had to confirm, you had to not check the reason or whether the patient is aware, you had to just convey this. Even in the last bullet point, when you had to emphasize the reasons for removal of stitches, I think you started explaining about the timeline and when the stitches are
yes,
whereas in this case, you had to respond to my question of why it is important to remove the stitches right now, right? So you had to give me a reasoning. You had to persuade me that, see,
actually, ma'am, I didn't read it.
So that you had to give me a reason that the timeline is carefully considered and the doctor has carefully assessed, and now is the appropriate time for us to remove the stitches. Having said that, I would like to, after the removal of the stitches, I would like to advise you on how to care for the wound at home so that it continues to heal well. And then there are 3 things you can say. That number 1, please make sure the wound is always clean. 2, it should always be covered. And 3, it has to be kept dry. Would you be able to do that? Yeah. And then finally, we can take the patient's consent. So before we... Yeah.
Can you please, ma'am, clear my first point, like confirm reason for visit? Can you please repeat it for me, please, ma'am?
Yeah, I was actually going to ask if it's okay. One of you can take the patient's role. I can take the nursing cue card and I can perform a reverse role play. And then you can go back and watch the recording and then make notes of anything that you find useful. Is that a good idea?
Okay, ma'am. Yeah, that's good.
Yeah, so who will take on the patient's role?
Me, ma'am.
Okay, Ishant. Should I send this role play card in the WhatsApp group? Or shall I send it in the chat?
Yeah, sure, ma'am. WhatsApp group, please.
I'm sending it in the chat as well.
Okay, ma'am.
Sent to you directly. I'm sending it to others as well. Please confirm that you received it, Ishant.
Received, ma'am.
All right, great. So, Faiza, would you again take on the role of the watchkeeper? Is Faiza still in the class? No, I would assign it to someone else. Who can do this? Any volunteer?
Yes, ma'am. Yes, ma'am.
All right, Amrit. Let me know when you start the timer.
Ma'am, I'm here.
Yes.
Sorry,
Yes.
I was unable to unmute.
All right. Shall I start?
Yes, ma'am. Please.
Good morning. My name is Gurleen. I'm one of the registered nurses in this clinic. Could you please confirm your first and last name for me?
You can call me Jenny Cole.
Right. And is it okay if I address you by your first name?
Yes, it is. It's okay.
Right. Jenny, I have your medical records here. I see that recently you underwent a medical procedure. How have you been feeling?
Yeah. Yes.
Okay, so the reason we made this appointment today is to remove the stitches and I'd also be redressing the wound after cleaning it to ensure it continues to heal well. But before I come to that, I would like to know if you have any concerns or questions.
Yeah, the doctor told me about that is a squamous carcinoma, and it is similar to cell carcinoma, which I am worried about the same condition. Can you please tell me about the condition?
It's natural to feel worried, Jenny. It can be overwhelming to receive this kind of diagnosis. So the medical
Okay.
squamous cell carcinoma is indeed a type of skin cancer. But I would not like you to be worried about it. Don't be alarmed because the surgery has already happened. We've taken the lesion out. So the chances of it spreading further are very unlikely. Right? But if it's okay
Right.
with you, I'd like you to talk about prevention here. May I proceed?
Yeah, you can.
Right. So there are two things I'd like you to do to make sure that it doesn't happen again. One, when you are home, please keep checking your skin to make sure that there's no discoloration or any changes in the skin. And number two, please make sure that you're regular with the follow-up appointments so that the doctor can detect anything that is not visible to the untrained eye. Would you be able to do both of these?
Yeah, you
Lovely.
can.
Great. Do you have
Yeah.
any questions so far?
Yeah. I'm worried about the further surgeries. Can you please tell me about the surgeries if I can proceed with the surgery in future?
It's normal to feel this way. I think I understand where you're coming from. I'm afraid I don't have that answer for you at the moment because this is not within my scope of work. But I'll make sure I'll get the doctor to speak to you about it. However, now that you're here, I'd like to focus on the prevention aspect of it. And for that, can I just check if you wear any sunscreen or you seek shade when you're out in the sun?
Yeah, I'm using a sunscreen. It is 30 IPS or higher maybe, and wear a hat. So I don't think I'm thinking that I'm taking this precautions as well.
Okay, that is great that you're doing this. And I would stress the importance of continuing to do this. It's crucial that you keep wearing a sunscreen. It's important that you keep seeking shade when you're out in the sun because this will greatly reduce the risk of any lesions developing further, right? Do you have any questions about what we've discussed till now?
Yeah.
Mhm. Any questions about what we've talked about till now?
Yeah, I'm worried about that. I'm already damaged. My skin is already damaged as I'm have a great sun exposure in my teenage. So now it is. I don't think it is now going to be well.
It's a reasonable
So
concern to have. I completely understand why you feel what you're saying, but let me reassure you that as long as you continue to seek shade and protect your skin during the peak hours using a sunscreen, the chances of it developing again will be greatly reduced. So please just continue to follow these preventative measures.
all right, I will.
If there are no further questions, may I check on your wound if it's okay? Any pain or discharge since the surgery?
Yeah, you can.
Right. Have you experienced any pain or any discharge since the surgery?
Yes, but I have a concern that it is necessary to remove the stitches for now. But as I am previously having a surgery, so I think the stitches is have to be there for my recovery of the wound.
I'm so glad to hear that you're actively taking an interest in your health management. Now, something I'd like
Okay.
to convey is that this timeline is carefully considered and assessed by the doctor. So trust me, this
All
is
right.
the right time for the stitches to be removed. And to ensure that the wound continues to heal well, there are three things you need to take care of. One, make sure that once I redress the wound today, you keep it clean, you keep it dry, and you keep it covered. Would you be able to do this at home?
Yeah, sure.
All right, great. All I needed to do was take consent. But this is how you could have performed this role play. If Ishan had asked me that question about the damage further, we could have completed this in the 5-minute time frame also.
Sorry
Yes,
about that.
ma'am.
But I hope
Yes,
it's a
ma'am.
good demonstration. I hope you found it useful.
Yes, ma'am.
Yes,
It's very
ma'am.
useful, ma'am. Ma'am, A grade.
Yes, 500.
Yes.
So I'll share this recording in the WhatsApp group. Unfortunately, we've run out of time. So probably day after tomorrow, we can do another role play card for doctors. And you can keep suggesting any topics that you would like me to take a class on. And then I can plan it accordingly. Today was
Especially on sensitive topics.
sensitive topics, right?
How to deal with the patient.
Ma'am, please breaking in any bad news to the
Reluctant
patient like
patient
this.
also. Yes.
This is very useful class for us.
Ma'am, reluctant patients speak.
Yes,
I
ma'am,
have some
reluctant
skill
patient.
lessons already about sensitive topics and about persuading patients also. I'll share both of these recordings today itself, and perhaps in the next
Okay.
class we can discuss a role play. Maybe that is best because isolated discussion of a skills class is very different to real-time application in a role play. So I'm also concerned about time management. I know you guys are already aware of the soft skills of the communicative criteria, and the good part is I have a repository, so I can use that and share it with you guys that you can watch in your own time. Of course, if there are any questions, just message in the WhatsApp group. I'm glued to my phone, so if you send a message, I'm very quick to reply. So I'll share these recordings, and in the next class, let's discuss another role play and focus more on the time management aspect. That is a crucial aspect that shouldn't be overlooked. Okay?
Yes, ma'am.
Lovely.
Yes,
I'll see you guys day after tomorrow. Thank you all.
Thank you so much, ma'am.
Thank you so much, ma'am.
Thank you, ma'am.
And
Thank you, ma'am.
Thank you, ma'am. Bye.